So this technique that I'm about to do is called Webster Technique. Webster Technique is awesome for our pregnant patients. What it does is it allows the baby to have 15% more space in the womb to move around, and it also takes off the pressure from our round ligaments. So as your womb is developing and as your baby is growing, we have a lot of pressure on our round ligaments. Those are the structures that hold your uterus up to your pelvic floor. You also have 2 in the front, you have 1 in the back, so we'll be checking both. But the most important thing is to make sure those round ligaments aren't tight so that you have proper space so the baby can move around. That way when we get into our 3rd trimester and we get checked at 36 weeks, our baby is face down, which allows us to not have a breech presentation. So disclaimer here, with Webster Technique specifically, a lot of times it is harder to do the Webster Technique in 3rd trimester alone if we have a patient that just starts, for the baby to, show up without a breech presentation. It's not a treatment for breech presentation, but it helps with it. So yes, I've had patients that come in our 3rd trimester and they get this Webster Technique done and they have a breech baby, and then by the time they deliver, they don't have a breech baby. Their baby comes out normally and they're able to have a natural birth. However, there are some patients that if they've had a lot of intrauterine constraint before they started, and they're maybe on their first, baby, or they're into their 3rd baby and they haven't had chiropractic care before, and we start doing the Webster Technique, their baby doesn't flip, especially if we only have 4 or 5 weeks until they deliver. So obviously the key to this is to start early. That way you have more chances of the Webster Technique really working at its optimum for those round ligaments to have less pressure, okay?